Dear friends, today I am happy to be with you all, but let me ask your apology for not joining the inauguration session. Please forgive me. To make this last moment change, I am not happy about it. Rajesh called me after we got the Padma Shri award that you come and motivate our student of Sola Medical College. And I was also interested to talk with youngster. So I said okay, but just for one program to come all the way from Jagadia to Ahmedabad, traveling 6 to 8 hours, I said okay, if there is another program in Ahmedabad, then we will plan both the program together. Then he called me few weeks back. Okay, now we have organized a conference, and I said conference with preventive and social medicine department all over the Gujarat. So I said okay, that is fine, but unfortunately the student went on strike, so that program was cancelled. But I did agree to come in this program also. But when I saw the program last evening, detail of the program, again that thought came to my mind, okay, why to go all the way just for this inauguration program? Because actually, to tell you frankly, I am not for this felicitation and I don't like it. And we in Seva Rural also decided that we won't take any award personally. So till now we were refusing. But when this award about the Padma Shri, someone has nominated us, then our friends in Seva Rural insisted that we are refusing other awards. But this is a different kind of award. It is a national recognition, highest recognition, and we must accept it. And let us see, we are selected or not. If God's willing, we are selected, we have to accept it because it will help the work of our organization. So I said okay, and then we were selected. So I strongly believe that this award is not given to me, to Lata Desai as a person, but it is given to our dedicated staff of Seva Rural, and another thing that those all of many people in the different sector of society has helped us in our work, including this preventive and social medicine department. Now, if I think about the earlier days that we wanted to work in the rural area, inspired by the philosophy of Mahatma Gandhi and Swami Vivekananda. And they said that if you want to serve India, go to the villages, live with them, find out their problem, and identify the solution, implement, and then you can do the service of India. So we thought that we will go to the rural area and work. But we were coming from the lower middle class. So we went to America to earn some money, came back, and then selected Jagadia, a rural tribal area, as our field, as our field area of field. And now let me tell you, because I am pediatrician Anilbhai Desai, my husband, but my Jivan Yatri, he was a surgeon. So we did not have any experience of rural health problem, though we were interested to work in rural area. So we started with the hospital, and after developing some rapport and credibility in the area, we met Dr. Mehta, N.R. Mehta of Surat, and we explained him what we want to do, why we want to do, and he was very nice, and he said, very well, I will help you whatever you want. And then he helped us in these initial years. So I remember Dr. N.R. Mehta today very much. He not only helped us how to do and what to do, but he sent one of his postgraduate student, Dr. Pankaj Shah, who is now managing trustee of Seva Rural, to work with us. And then we started working in the field, first to identify the problem and its extent. We did baseline survey, and in this baseline survey also I remember Professor Anil Navale of Baroda Faculty of Science, and he sent his student, that MSW student, to conduct this baseline survey. We found that this infant mortality rate, perinatal mortality rate, newborn mortality rate, maternal mortality rate was so high. So we thought that let us work to reduce this death. And then we thought that let us take the participation of the locally available resources. And at that time, the 80 to 90% of deliveries were conducted by our dais, that is traditional birth attendant. Then in the government program, Anganwadi worker was there, and male and female multipurpose worker were working in this area. So we started working with them. We trained the traditional birth attendant because they were the obstetrician and the neonatologist in rural area. So we trained them, we trained Anganwadi worker, and we had several meetings with our director at the Gandhinagar. We met the health minister also, and then we said that we want to take one area, one PSC area, but we will have our own staff, and they have to transfer the government staff to other places, and they agreed, and we took the responsibility of primary health center, and we work we managed that for 15 years, and now I remember that after working for 15 years, that Dr. Prakash Koteja, Dr. Mazmudar of Baroda helped us to evaluate our PSC program, and this is the book, The Making of a Primary Health Center, Seva Rural Experiences. And in this book, I don't know how many of you know about it, but we have listed so many things, and we have introduced about how many interventions, so many interventions, and then we have done field studies also, about 30 field studies, and many papers, more than 30 papers are published in various national and international journal. The list are given in this book, Making of a Primary Health Center. So this is about the PSC. So we work with the village level worker, then took the responsibility of primary health center, and then we thought, let us expand. Rather than working only in 40 villages, let us take a whole block. And then with the collaboration with UNICEF, we took the responsibility of first referral unit, and that was the first referral unit in the whole of the India, and that experience also was documented in some other way. So this is because our heart is with the people, with the community. And now today I thought that I will not come just for this felicitation, but our colleague Dr. Dhiren Modi is here, and he is our co-worker, our core group member, our trustee, as well as he is the director of our community health project. So in detail what we are doing, what our future plan, he will talk about it. So I postpone this idea, so please forgive me. Thank you.